Hi everyone, my name is Dr. Viju Jacob. I'm a pediatrician and the medical director for Urban Health Plan's school-based health program. I'm joined by my colleague, Dr. Gladys Banegas, who is a pediatrician who works at the Adolescent Health Center here at Urban. Urban Health Plan is a network of community health centers and school-based health centers with locations in the Bronx, Corona, Queens, and Central Harlem. Today, we hope, as both of us are parents and pediatricians, we want to sort of talk a little bit about what school reopening may look like, how we can keep our children safe while they return back to school, getting them ready to go back to a learning environment, and then what sort of immunizations should we get ready for as we get ready for a new school year. So most likely, school is going to be a mix of remote and in-person learning. Most schools will have somewhere between 30 to 50% of the students in the building at any given time doing in-person learning. There will be a combination of what's called synchronous, meaning they're gonna, the kids that are at home will be directly talking to a teacher while they're learning to some degree during the day. And then there's gonna be other times when they're gonna have asynchronous, meaning that it's gonna be recorded and then sent to your child so they can sort of review the material during the course of the day. From what we understand, students will be kept in groups. So the same group is going to be with the same set of teachers over the course of the day. That will help while the students are in school, that in case one of them turns out to be sick and has COVID, it'll be easier to sort of identify who's at risk of getting exposed and what we do with those patients, those students. What we know now is that most likely there will be some version of a COVID screening that parents will have to fill out either before they come to school or when they get to the school building. All people, so whether it's students, teachers, everyone will have to fill out, answer some questions about a COVID screening, and then they'll have their temperature taken in the building. If their temperature is high or if they have any of the COVID symptom screens, they'll be asked to go home. So they will be put in a safe area until a parent can come pick them up, but they will not be having in-person learning that day. So it's important that you monitor your child at home and not bring them to school if they're sick because they're going to be sent home. The city has released today some detailed plans about how what they will do if students get sick in school and what teachers get sick in school. So it's important that you check the New York City Department of Education website to get the most up-to-date information about how they will be handling sick students, how they'll be notifying parents, what the parents need to do with any other students that may have been in the room with a sick student or a sick teacher. So remember, the New York City Department of Education website is going to be an important place for all of us as parents to be checking regularly as they provide updates. So some of the other things that, Dr. Banegas and I have been talking about is how do we keep our children safe as we have them return back to school? So Dr. Banegas, what are some of the things we can think about while our children return back to school?
Thank you, Dr. Jacob. Staying safe is very important. Continue staying safe by encouraging hand washing and using the hand sanitizer more frequently. Remember, when you wash your hands, you have to do it for 20 seconds, which is equivalent to 2 ABC songs you can tell your children or to 2 birthday songs. Remind them that if there's not a hand washing station nearby or available, they can use the hand sanitizer. Also remember that when you purchase a hand sanitizer, it's got to contain 60% alcohol and no methanol. When you use the hand sanitizer, especially it's important to use it before and after eating, when coughing, sneezing, or when you're adjusting your face mask. Remind them to always wear a face cover. Practice with your children how to put it on and how to take it off. Keeping physical distance between the children, ideally 6 feet. And students should ideally have extra space when they're singing or when they're exercising. Avoid sharing objects like pencils, pens, erasers, crayons, musical instruments. And like Dr. Jacob said, you have to monitor for signs or symptoms of COVID-19 in children, which sometimes can be a little bit tricky because children tend to have milder symptoms. Look out for temperature more than 100 degrees Fahrenheit, cough, sore throat, headaches, body aches, diarrhea. Remind them if they're not feeling well during school that they have to tell an adult. And then the parent should be contacted and pick them up, and also contact your pediatrician.
So Dr. Banegas, as we're getting our children ready for school, what are some of the things we can do between now and the start of the school year to get them ready?
That's right. As we're getting ready to school, it is important to establish daily routines. For example, in the morning, you can pack an extra face cover, a hand sanitizer, a water bottle, and when they come back from school, remind them to immediately wash their hands. Take off their face cover, wash the face cover. Also, maybe take a shower, remove their clothes, take a shower, put new clothes. For younger children, as I said, remind them of hand washing, practice hand washing, and how to do activities with physical distancing. It is important to take care of yourself. Encourage your children to eat a well-balanced diet, have plenty of rest, and exercise, because this can help them fight off illness. This can build up their immune system.
So Dr. Banegas, as children are starting to hear some of this stuff from both parents and from the news media and things like that, they may have questions or they may not have questions. So how should we be talking to our children about some of these concerns?
Yes, it's important to stay up to date with the information so that you can speak to your children in a truthful manner and offer reassurance.
Yeah, and it's important that different kids learn at different ways, right? So you all know your children so much better than all of us. So, use what works for them. So some children like, to see little videos about things, and there are lots of things on the CDC website where you can look at little videos that are age appropriate for children. There are, things at the American Academy of Pediatrics website about how to talk to your children about some of these things. So, use age-appropriate material, age-appropriate language. Some of our teenagers, I have a couple of teenagers at home, they don't necessarily want to ask us anything, but it's important that we reach out to them for, give them reassurance, because it's much better for coming from us than from someone else where they may not be giving the factually accurate information. So I think it's very important that we talk to our children at the level that you feel comfortable talking to them at.
That's correct. It's important that you talk to your children, answer the questions in a truthful manner, and correct misunderstandings.
And the other thing, all of us as working parents have to think about is we have to plan for childcare. So whether it's, what do we do on some of those remote learning days? What do we do in case our children are sick at school, or if they need to be isolated because someone else was sick in their class? So, use this time before school opens to sort of think about what are going to be our childcare options. Who can we rely on? Is there places that we can go to? Now, the city will have some access to childcare. Again, it'll be on the city's Department of Health, Department of Education website. So, please look on it regularly, but don't plan that the city will have access for everybody to have childcare through them. So, think about what we can do for our children now as we plan for the new school year. So Dr. Banegas, some of the other things that come up, before the start of every school year is, us as parents are always sort of getting them ready through immunizations and stuff. So, what are some of the things that parents should be thinking about when it comes to their immunizations?
It's very important that now you check in with your pediatrician to make sure that your child has all his vaccinations, that he's up to date with his vaccinations before the start of the school year. Also, it is important, especially this year, that all your family members, I encourage all your family members to get their flu shot, because this year we don't know what could happen if, God forbid, your child gets sick with the flu and COVID at the same time. This could lead to a more serious illness.
Yeah, I want to completely agree with Dr. Banegas. It's an important year every year to get the flu vaccine, but this year especially, it's important that, as soon as your pediatrician's office has the flu vaccine available, or for yourself in your own doctor's office, seriously consider the entire family getting the flu vaccine, because come fall, there's a possibility that you may have both flu and COVID around. And if you're protected against the flu with the flu vaccine, it's one less thing for all of us as parents to worry about. So I really emphasize that all of us should try to get the flu vaccine as early as possible. Many doctors' offices have the flu vaccine as early as September, most definitely by October. So, really start thinking about using some of that time to get the flu vaccine. Um, what are some other things that parents can sort of do, Dr. Benegas, to sort of make sure that the children are ready to get back to school by checking in with their doctor?
I think we pretty much covered the major things. Just making sure that that you check your children, make sure that they're not sick before they're sending them to school. Like we said, they could be mild symptoms, and just in this case, maybe keep them home if they're having cold symptoms, because we don't know if it could be related, and checking with your doctor.
Yeah, and just checking with your doctor. Many offices, including Urban Health Plan, offer what's called telehealth visits. So you can see your doctor, sort of like how you're watching this video, through a video conference call. You can discuss a lot of things that you may be worried about, things you want more answers for. And also for, most minor illnesses, we can sort of see them through telehealth visits. If you're worried about coming into a medical facility, many of the illnesses can be taken care of through a telehealth visit. And then if you need to come in, you're only coming in just for that specific service that you need as an in-person visit. So, this is a great opportunity. Use some of this time to do outreach to your doctor's offices, to get an opportunity to speak to them, address your concerns, make sure they're up to date on their immunizations, if they need a physical for anything, getting ready for things along those ways. Just one of the other things to mention is, most likely for our older children that may be involved in school sports, they probably will not have a regular sports season until later in the school year. So what we're hearing is many school districts, including New York City, most likely, like the PAL program and stuff, won't start till about December. So there's also less of a requirement that if your child already had a physical, you don't necessarily have to get a new physical just to do sports. So the New York City Department of Education has built some extra time for parents to get access to the services that your child needs and things. So it's important to check with the New York Department of Education website. We hope this conversation was helpful in deciding what's best for you and your family as the coming school year comes. Urban Health Plan is always open to help you with your healthcare needs. We have both telehealth and in-person visits. We go through lots of safety precautions to make sure that our facilities remain safe. We make sure we check everyone before they come into the building with symptom screening and a temperature. We separate sick patients from well patients. So, you shouldn't be scared about coming into a clinic into Urban Health Plan at any point. You can reach us on the phone number that's on your screen. And again, thank you so much for tuning into this broadcast.